Good day, everyone. You are all welcome to today's presentation. And today we are going to talk about Neuro Imaging. And this will be the outline for our discussion today. Today we will talk about the introduction, and the introduction will give us a brief description about what Neuro Imaging is. And we will also talk about the history of Neuro Imaging, the various types of neuroimaging, and the use of neuroimaging in different psychiatric conditions. Then we have a conclusion and discussion. And this is the intended learning outcome for today's activity, and it's hoped that by the end of this lecture, students will be able to discuss how neuroimaging works, recognize the differences between the various neuroimaging modalities, discuss the significance of neuroimaging in psychiatric diagnosis. What's neuroimaging? Neuroimaging is the use of various techniques to either directly or indirectly view the structure and function of the nervous system. Neuroimaging has advanced from primitive scar films to high-resolution visualization of the human brain. So we will have a look at the brief history about neuroimaging. Neuroimaging first started with the development of X-ray, which was done in 1895. Actually, after the development of X-rays in 1895, it wasn't used to visualize the brain until Sir Victor Huxley, who was the first neurosurgeon to use X-rays in neurosurgery in the late 19th century. And CT scan was later developed based on the ideas of William Oldendorff, and it was later mathematically developed by Alan Cockman. And Alan Cockman consulted Geoffrey Horsfield, who also developed a cross-sectional scanner based on William's concept. And Horsfield and Cockman received a Nobel Prize in 1979 for their innovation, that's the development of the CT scan. However, the first CT scan was done in 1972 on a woman who was suspected of having a brain tumor. When we look at the picture over there, this shows the first CT scan that was done on the human who was having a brain tumor. Later in 1980, Ogawa observed that oxygen level was dependent with and it became more visible as blood oxygen in the human body decreases. So in 1991, Belevo observed first functional images using contrast agents. And in 1992, Ogoreiter and Koch-Echtel published their first functional images using the Bode signal. So we'll have a look at the types of neuroimaging. We have two main types of neuroimaging. We have the structural neuroimaging and the functional neuroimaging. Just as their name implies, structural neuroimaging helps to provide a non-invasive visualization of the human brain, whilst functional neuroimaging provides a visualization of the spatial distribution of specific biochemical processes in the human brain. From the first scan that we could see that we can actually visualize the structures of the brain. However, the second image provides a detailed visualization of the various specific biochemical processes in the human brain. So we go on to talk about the types of structural neuroimaging. We have 4 types of structural imaging. We have the computer tomography, the magnetic resonance imaging, angiography, the magnetic resonance angiography, and the computer tomography angiography. For the types of functional neuroimaging, we have the functional magnetic resonance imaging. Then we have the emission tomography. Under the emission tomography, we have 2 main types. We have the positron emission tomography, the single photon emission computer tomography, the magnetic resonance spectroscopy, and the diffusion tensor imaging. For magnetic and diffusion tensor imaging, we won't be discussing in this class. but we'll briefly talk about the various other types of functional and structural neuroimaging. So this is a brief indication for CT, which is an MRI used to assess for is used basically for anatomical assessments. The functional MRI is used for studies of cerebral blood flow. The PET and the SPEC is for probes of neurotransmitter functioning. Uses of neuroimaging. Why do doctors prescribe neuroimaging for patients? Mostly, neuroimaging is used in patients who have experienced head trauma, suspected of having certain neurological deficits like dementia and epilepsy, patients who have brain tumor, cancer patients, chronic infections like tuberculosis and neurosyphilis. And also, neuroimaging is also used in clinical research when researchers want to actually analyze brain activity during performance of specific tasks. So we will briefly go into details about computed tomography or computed axial tomography. We will simply call it the CT. So CT uses computerized process combination of many X-ray measurements, which are mostly taken from different angles to produce a two-dimensional or cross-sectional images of the anatomy of the human brain. This simply means that when looking at the diagram below, we could see the CT machine. So when a person is being put on the stretcher, the person is being pulled into it, and the oval openings of this machine takes images of the human brain from different angles. And the CT scan involves lower levels of radiations, and they create X-ray images. So to occur CT machine, a beam of photons rotates around the human head. And as the photons rotate around the human head, it takes various images from different angles, and they produce a two-dimensional or cross-sectional images of the human brain. And this diagram will give us a brief idea about how it works. Looking at the diagrams, the beams around the oval shapes, those are the photons that goes around and take different images of the human body that is being examined. Bone is being scanned. It appears dense white on the X-ray form, and calcification appears white. Cerebrospinal fluid appears gray-black. Brain matter appears gray, blood appears white, and air also appears intense black. When do we doctors prescribe CT scan for patients? When a patient is suspected of having infection, tumors, calcifications, hemorrhage, bone trauma, and brain disorders. So there are times when doctors want to actually highlight certain structures in the human brain, like the blood vessels. So in order to highlight these structures within the X-ray films, there is this agent that is being given intravenously into the human arm, and that is the CT contrast agents. These CT contrast agents' main purpose is to primarily highlight structures such as blood vessels, which will be very difficult to associate from their surroundings. So looking at the diagram over here, this is some types of CT contrast agents that are being injected intravenously into the human veins. And when this gets into the bloodstream, it helps to heighten or help the doctors to actually visualize the blood vessels within the human brain. And this helps in providing 92% accurate diagnosis, and it has harmless interactions with the body. And there are these two types of contrast agents. We have the ionic and the non-ionic. The ionic contrast agents have high osmolarity, meaning when it gets into the blood serum, it's high concentration. However, the non-ionic dilute easily within the bloodstream. So when do we doctors prescribe contrast agents, CT contrast agents for patients? When patients who have history of a seizure, patients who have cerebrovascular accidents, and intracranial space occupying lesions, including the CNS tumors and metastatic lesions. So we will delve more into ionic and non-ionic contrast agents. Both of these agents are associated with allergic reactions. However, the non-ionic agents, because of their ability to dilute easily into the bloodstream, has lesser rates of allergic reactions. So as a nurse, when patients are being prescribed ionic or non-ionic contrast agents or ionic CT scan, you have to look out for these allergic reactions in these patients. So before you can, when patients are being prescribed the ionic or non-ionic contrast agents, you have to take a brief history about these patients. First, you have to inquire whether these patients have had previous allergic reactions to a contrast star, whether the patient is diabetic, patients have renal insufficiency, the patient is someone suffering from sickle cell disease, or have any other serious medical condition which might react with these ionic agents. And patients on metformin should help taking this metformin before going for these scans. So it is very important for us as nurses to take a thorough history about these patients and ask these patients if they have any previous allergic reactions or are diabetic or have renal insufficiency. So how do we prepare patients for brain CT scan? First, as I previously said, you have to take a thorough history about these patients and also inquire if patient is pregnant, as these patients will be exposed to certain form of radiation which might be dangerous to the baby or the mother. And you also have to ensure all jewelries and piercing have been removed from these patients during the day they are supposed to go for these CT scans. Also, it's important for you to allow these patients to sign consent forms in cases where contrast agents are being prescribed for these patients. And when patients are going for the contrast CT scan, you have to instruct them not to eat 3 hours prior to the scan. However, they can take in water, and diabetic can only eat light meals 3 hours prior to the scan, and they have to discontinue medication intake 48 hours after the CT scan. I mentioned previously, like diabetic patients who are on metformin, they should withhold the metformin hours before the CT scan, and they are not expected to take their medication 48 hours after the CT scan. So after 48 hours, they can start taking their prescribed medication. So it is very important for nurses to inform patients about these requirements. So we will briefly talk about certain allergic reactions to contrast agents. There are two types of allergic reactions. We have the type A, which is very common, and the type B, which is rare. The type A reactions include nausea, vomiting, rash, urticaria, itching, and sneezing. So as a nurse, if a patient on your ward has been prescribed with a CT scan with contrast agents, you have to be observant and observe for these type of allergic reactions in your patients. You can inform patients to expect or report to you if they have any of these type of allergic reactions. So for the type B is hypersensitivity reactions, and it's not very common. The first incident of the type B reaction was recorded in 1983 and in 1987. Currently, there is no records of hypersensitivity to the contrast agent. And some of the symptoms these patients might show is itchy rash, throat or tongue swelling, shortness of breath, vomiting, and lightheadedness, and sometimes which occurs rapidly and sometimes may lead to death. So what are the advantages of taking brain CT scan? Brain CT scan is less costly, and later we will know why, as compared to the other CT scan, other neuro images. CT scan is less costly and is less sensitive to patients' motion or movements. So if a patient, let's say a depressed patient or a demented patient is being asked to take a CT scan, if they move or fidget within the X-ray machine, the CT scan can still be done, as it's less sensitive to patients' movement. And it's faster than the MRI, and it also gives a detailed evaluation of the cortisol burn, and it accurately detects classification and foreign bodies in the human brain. And there is no risk in patients who have implantable medical devices, and it's also easy to perform in very obese patients, as there is more room in the CT scan. So patients who are obese can fit in, and some slim patients can also fit in. Limitations of the CT scan: because of the use of contrast agents, and as we've talked about previously, certain type of patients have allergic reactions when they are being given contrast agents. So patients with renal diseases, it can potentially lead to acute renal failure. Then we'll briefly talk about magnetic resonance imaging. Magnetic resonance imaging is actually based on the manipulation of small magnetic fields and pulses of radio waves energy to give detailed digital cross-sectional images of the human brain. It produces high quality and resolution brain images without subjecting the patient to radiation, unlike the CT scan, which exposes the patient to some radiation. The MRI does not expose patients to radiation. How the MRI technique is based on nuclear magnetic resonance, and whilst the CT scan produces two-dimensional images, the MRI produces three-dimensional images, and these images are produced in the axial, coronal, and sagittal planes. So what can the MRI detect? The MRI can be used to detect brain tumors, aneurysm, bleeding in the brain, nerve injury, damage caused to the brain by stroke, torn lining of the blood vessels, problems with the eyes and optic nerve, as well as the auditory nerves. So just like we talk about the appearance of cerebral tissues on MRI, the CT scan, also this is how the various tissues appear on an MRI radio frequency pulses. The MRI uses two radio frequency pulses. We have the T1 and the T2. And on the T1, air appears in dense black, and on both T1 and T2. However, fats and lipids appear white or bright on T1 pulse, but appears dark or black on the T2 pulse. So these are how various tissues in the human brain appears on the MRI images. So this is an example of an MRI images, and like the previous one, this looks quite different from the CT scan, as this one also gives a thorough view of how the human brains look like. How do we prepare patients for an MRI scan? For MRI scans, there is no restriction of food intake. Patients can eat prior to taking the MRI scans. However, you have to also ask patients if they have allergies to contrast materials. Patients with metal implants like cochlear implants, clips for brain aneurysms, metal cords, pacemakers, they cannot use this to enter the MRI scanning area. So you have to actually, as a nurse, ask patients if they have any metal implants in their body. And if they do, you have to inform the surgeon accordingly. And mostly patients who are claustrophobia, fear of space, or anxious patients cannot take MRI because the MRI is very sensitive to movement. Patients with tattoos too cannot take MRI scans. Advantages of the MRI. As we said earlier, the MRI does not expose patients to radiation, so it's one advantage, and it also helps to evaluate both the structure and the functions of the brain, and it also helps to detect structures that can be obscured by artifacts from bones in the CT images, and smaller risk of causing potential or lethal allergic reactions with the contrast mediums. However, we have various limitations of the MRI. Just like we said earlier, patients with pacemakers or cardiovector defibrillators and loop recorders cannot take MRI. So patients who have these implants with them cannot take the MRI. Pregnant women in their first trimester also cannot have MRI. As comparing the price of MRI to CT scan, MRIs are very costly, so not every patient can afford it. And breastfeeding mothers also cannot breastfeed their babies for 24 to 48 hours after the contrast medium is given. So if a patient comes and the patient is a nursing mother, you have to inform the mother to actually express some of her milk into a bottle before taking the MRI. As after 24, she can't breastfeed her baby within 24 to 48 hours, and she can only breastfeed her baby 24 hours after the MRI. And mind you, it's only patients who are going to receive MRI with contrast medium that cannot breastfeed. And also, very obese patients may not fit into certain opening of certain types of the MRI machines. And also, the MRI machine cannot distinguish between cancer tissues and brain edema. To talk about functional MRI. Functional MRI is used to measure and map the brain activities, and it produces information regarding how the brain functions, and it also uses magnetic resonance imaging to measure the metabolic changes that take place in an active part of the human brain, and also use blood oxygen level to detect which part of the brain is being engaged when the patient is performing certain activities. So let's say we have dementia patients and we would like to know how which part of the human brain is being stimulated when these patients are being exposed to certain type of activities. So what they do is they put these patients in certain machines and they are shown certain images. So when they show the images to these patients, it's believed that when certain part of the brain is active, blood flows into that part of the brain. And when the blood is flowing, it will display which part of the human brain is being stimulated. So if the patient is talking, then the MRI and functional MRI machine will show which part of the brain the person is stimulated when the person speaks, which part of the human brain is stimulated when the patient tap their hands. So when you tap your fingers without talking, then the machine will tell the one performing the MRI function that this part of your brain is active and which part is dominant during the activities. And when you are listening, like as you are listening to this information, certain parts of your brain is being active and blood flows over there is increased. So when the blood flow over there is increased, the functional MRI machine picks on that and highlights which part of your body blood oxygen level had increased over there. And functional MRI will help us gain insight into how memories are formed, language, pain, learning, and emotions. Then indication of functional MRIs. The functional MRIs is used to examine the human anatomy. It's also used for brain mapping, as we have talked about before. So with brain mapping, patient is asked a specific task, and when the patient is performing that task, there is increased blood flow to certain parts of the brain, and this will elicit when speech, it will help to show which part of the brain is used for speech, movement, and sensation. It also helps to assess the effects of certain conditions like stroke on the brain tumors, and degenerative diseases like dementia. It also serves as a guide for planning surgery or radiation therapy, and it also monitors growth and function of brain tumors. So the advantages of functional MRI is it's non-invasive and does not involve radiation. It has a good excellent spatial and temporal resolutions, and it also provides images of the brain function and structures. And it's also widely used, so information can be compared with other lab results. Because functional MRIs is very easily available in various hospitals, so information from one lab can be compared to other lab results. So we go on to talk about the limitations of the functional MRI. The functional MRI has limited resolution, and it's when it assesses neural activities, and it takes 20 minutes to 3 hours to acquire sufficient images, and it requires the patient's head to remain in the exact same position. So imagine patients with Alzheimer's and schizophrenics who have been asked to take functional MRI. Certain patients cannot stay at one position for long. So within 20 minutes to an hour, this patient cannot stay still for their images to be taken. So certain patients cannot take functional MRI. And it has limited clinical utility in psychiatric disorders because, most of our patients have medic tendencies. They are very hyperactive. So they can't stay still for 20 minutes to 3 hours just waiting for one image to be taken. And functional MRI is very sensitive to the sense that even irregular heartbeats can affect images, quality of the images obtained. And the analysis is very complex and time consuming. So this is just a brief summary of the differences between functional MRIs and MRIs. Whilst MRI studies the human brain, functional MRI studies the human function and structure. So functional MRIs give detailed information about what's going on in the human brain, which part is activated, how neurotransmitters are being sent throughout the human brain. So we will go on to talk about emission tomography, and under that we have the PET and SPECT. SPECT is used to diagnose or monitor brain disorders, heart problems, and bone disorders, whilst the PET shows how the brain and its tissues are working. So for emission tomography, there is a special dye which contains radioactive traces. And before these scans are being taken, these dyes or tracers are either swallowed, inhaled, or injected into the vein of the patient. And this will help to show how the tissues and various parts of the human brain is working. And it helps to give a high sensitive and good spatial resolution. And it has limitless penetration depth because of the special dye that is being introduced into the human bloodstream. And Emission tomography is based on the assumption that high radioactivity is associated with brain activity. So we will first talk about when patients are being prescribed the PET scan. The PET scan is mostly used to detect brain disorders and diseases. The PET also shows metabolic changes occurring at the cellular level in an organ or tissue, and it is the only scan that examines tissue at the cellular level. And certain brain disorders that PET can be prescribed for the patients are patients with dementia diseases, Alzheimer's, Parkinson's, frontotemporal, and the Huntington's diseases. The ADHD, autism, seizures or epilepsy, stroke and cancer, cerebral blood flow, blood volume, oxygen uptake, glucose transport and glucose metabolism, head injuries, and hidden bone fractures in the human brain. So how do we then prepare for PET scan? In fact, before a patient go for a PET scan, preparation are taken 48 hours before the scan. So preparation starts from 48 hours till when the scan is actually taken. So from 48 hours, as a nurse, you have to inform these patients that they are not supposed to take part in any strenuous exercise or deep tissue massage. Strenuous exercise like jogging, doing cardio exercises, walking long stretch of mass, and you have to inform these patients at hand. It's important to actually let patients know that they are not supposed to take part in any strenuous activities that will cause exertion or fatigue. Then from 12 hours, also you within the 48 hours, you need to inform breastfeeding mothers that they need to pump and store breast milk 24 hours prior to the procedure, and they cannot breastfeed their babies 24 hours after the procedure. So 24 hours before the procedure, breastfeeding mothers are supposed to pump and store breast milk. That will last the babies from the 24 hours, then 24 hours after, as they can only breastfeed their babies after 24 hours. And then 12 hours to the PET scan, you have to instruct the patients way ahead of time not to eat any high carbohydrate diet. They have to go on a low carbohydrate diet, meaning no sugar diet. Carbohydrate diets like cereal, pasta, milk, fruit juices, alcohol, jams are avoided. Patients can, however, eat meat, hard cheese, tofu, eggs, vegetables, any form of vegetables like broccoli, spinach, and green beans. And if the scan is scheduled for late afternoon, low carbohydrate breakfast can be taken. Then 6 hours before the appointment, patients are supposed not to eat 6 hours to the PET scan. However, they can drink a little bit of water, and they have to wear comfortable clothing, and they must be prepared to stay approximately 30 minutes before the PET scan is being taken. And because this radioactive material will be injected into their system, it takes 30 minutes for it to start working. So patients will be asked to stay 30 minutes before the PET scan will be taken. Also, it is important to inform patients that after the PET scan, they are supposed to drink a lot of fluid, a lot of water to help flush out the radioactive agents. And also, they should limit, if the person is a breastfeeding mother, they should also limit contact with their baby for 12 hours. So this is important things to note Is it very important for us as health professionals to note and inform patients accordingly when they are scheduled for PET scan? So, as I said, PET scan preparation starts from 48 hours before the scan. So how then do we prepare for SPECT scan? For the SPECT scan, unlike the PET scan where we prepare 48 hours, for the SPECT, there is no special preparation needed. However, you have to make sure you inform the patient to leave any metallic jewel like earrings, necklace, bracelets, everything. Tell them to leave all these type of jewelry at home. And also inform the technician if the patient is pregnant or breastfeeding. Also, medication and any supplements which is being taken by the patient should be discussed with the radiologist way before 48 hours before the SPECT scan can be taken. Then also during the SPECT scan, there is injection of the radioactive substance in the arm of the patient, intravenously in the arm. You have to also inform the patient that they will experience some cold sensation at the site of injection, and they're expected to lie quietly for 20 minutes. And you also have to alert them that slight bleeding or swelling at the injection site is expected. And you have to also report allergic reaction to the radioactive tracer. And also, just like the PET scan, for the SPECT scans, patients are supposed to take in a lot of fluid to help flush out the SPECT from the human system. Mostly SPECT scan lasts from 1 hour to 2 hours. And within the SPECT scan, the SPECT scan also helps to show how blood flows through the arteries and the veins in the brain. And also, it also shows how blood flows through the various tissues and organs. So when the radioactive substance is being injected, it highlights how blood is flowing within these tissues and organs. So what are the advantages of taking PET and SPECT scan? The SPECT and SPECT is capable of detecting areas of molecular biological details, unlike the CT and MRI, which isolate anatomical changes in the body. So, for example, let's say a patient is having a seizure. What some radiologists do is that if a patient is experiencing a seizure, they perform the PET or SPECT scan whilst the patient's head, so they put the patient into the PET scan, and this can be performed, so they perform the task in between. So they actually test to determine which areas the blood flows to when the patient is in seizure. So if a patient have a recurrent seizure, these patients, you can put them through a PET scan where the brain is being scanned. So once the patient goes through the PET scan, the scan will highlight which part of the human brain the seizure is originating from. As blood flow to that area will be increased during, and the scan will highlight which area of the body oxygen level has increased or blood flow has increased. However, we have few limitations of the PET and SPECT scans. The PET scanning is non-invasive, but however, it exposes the patient to ionizing radiation and is very costly as compared to the CT and the MRI. And it also has poor spatial and temporal resolution, availability and stability of short-acting radioglands. So now we will briefly talk about how neuroimaging is used in diagnosing certain psychiatric conditions. For dementia, neuroimaging aids in the diagnosis and management of dementia. So when we take Huntington's diseases, Its abnormality or chemical abnormalities can be detected using the PET scan. And CT scan can also help differentiate vascular dementia from other dementias. And the CT scan can highlight whether there is atrophy in the cerebral and part of the human brain, or there is ventricular enlargement. So in dementia, CT scan will highlight that. Let's look at this part of the So when we look at the brain with ADH and the normal aging brain, we realize that there is a cerebral atrophy of the part of the brain with the ADH, that's Alzheimer's disease. Whilst with the normal aging brain, there is no atrophy or shrinkage of the cerebral cortex of the brain. Then looking at the MRI scan spool, you realize that there is ventricular enlargement of the brain with the dementia. So with MRI, it's used to detect neurodegenerative dementia, and it requires high resolution. So we use the TI to actually examine focal loss of the gray matter or atrophy. So when we look at here, we realize the gray matter has reduced in size. So MRI will help detect. So when a scan of a patient suspected of having Alzheimer's disease or dementia, MRI will help, scan will show that the brain has, the cerebral cortex of the brain has atrophied. And also MRI helps to also detect atrophy of the putamen and the caudate nucleus in the patients with Huntington's disease. Then with obsessive compulsive disorder, MRI is also used. So MRI also detects decreased total cerebral white matter volume. When we look at this scan compared to the normal human brain scan, we realize that there is a decrease in the cerebral white matter over here. There is a bit shrinkage in the volume, and there is a smaller volume of the basal ganglia segment, and there is abnormal pituitary volume and corpus callosum length. So these are the changes that will be observed in a person suffering from obsessive compulsive disorder. Then the PET and the SPEC in obsessive compulsive disorder. When we look at the two diagrams below, when we look at the normal control human brain and the obsessive compulsive, we realize that there is in heightened brain activities in the obsessive compulsive disorder patient's brain. Realize that various parts of the brain is engaged in a certain type of activities as compared to the human brain. So these two patients were being exposed to the same item, but we realized that the obsessive compulsive disorder patients have heightened or increased brain activities as compared to the normal patients. Then in schizophrenia, CT scan and MRIs are also used to detect whether a patient has schizophrenia or not. And in CT scan help to show dilated cerebral sulci, there is cerebellar atrophy, enlargement of the ventricles, and there is abnormal ventricular size, and it is very worse in schizophrenic. When we look at the diagram on the left side of the slides, we realize that the ventricular size has increased, widened in the schizophrenic patients as compared to the healthy brain. And these are the findings mostly found in patients with schizophrenia using the PET and the SPEC scan. There is low utilization of glucose in the cerebral gray matters when PET is used. There is hypofrontality. The SPECS also shows a decreased left temporal lobe activities with increasing positive symptom scores. So these are some of the things that will show on a patient with schizophrenic scan when using PET and SPEC. Then with depressive patients, MRI, PET, and SPEC are also used. And these are some of the findings that will show in the scan from patients with depression. So with MRI, ventricular enlargement is expected, cortical atrophy is also expected, widening of the sulci of the brain is also accepted. There is also abnormal hyperintensities in the periventricular area and basal ganglia and the thalamus. And there is also diffuse and focal area of the atrophy. For SPEC, it will show reduced baseline cerebral blood flow in the frontal cortex and the subcortical nuclei. Also, there will show a decreased cerebral blood flow in the parietal-temporal and the cerebral region bilaterally. So, from what we've gathered so far, we realized that PET and SPEC can also aid in diagnosing certain mental conditions. And technological advancement has provided enough information regarding the underlying causes of certain illnesses through neuroimaging courses. As mental health practitioners, we must prepare ourselves for the likelihood that neuroimaging can provide positive markers for clinical practice. And thank you so much for listening to today's lessons. And this is few questions I would like you to consider. And the question is, despite the achievements made by neuroimaging, clinical use in psychiatric disease diagnosis is limited. So the question is, what are the possible reasons that might account for this? And can neuroimaging be an effective tool in diagnosis? Or we should stick with the traditional method used in psychiatric diagnosis? This is an important question we should deliberate on as mental health professionals, and outweigh the benefits and disadvantages of using neuroimaging in patient diagnosis. Thank you. And these are some references. Thank you.